Come in.
Hi there.
Hi.
Hi, Patty. My shift is ending, so I wanted to introduce you to Lisa, who's coming on as your nurse for today.
Hi, Patty.
Lisa.
Nice to meet you. Oh, nice to meet you.
She is fantastic and helps a lot with breastfeeding. She did some training for lactation counseling. So
oh, great. That will be a big help.
But I hear you're already doing really well and you're off to a good start.
So Patty is the mother of 2 children. She had a repeat C-section last night at 11:58. And she has a beautiful baby boy named Eli, who's right here.
Oh,
good sized baby.
He is a very big,
cute.
big happy baby.
Yes, very big.
You said Eli.
Yes. So Patty does not have any allergies. Her OB is Dr. Sansonetti, and the pediatrician is Dr. Tenenbaum.
Okay, great.
Okay. And Patty has a history of gestational diabetes. So Eli has been getting blood sugars, 12 hours of blood sugars. And so far they've all been over 45.
Okay, great.
The next check is due at 9 o'clock, so 9 a.m.
Mm-hmm.
And I've encouraged Patty to do skin to skin before every single check, and that's been working really well so far.
Yeah, it seems to be.
So,
good.
okay. All of the vital signs have been stable for both of them, and all of the postpartum checks have been stable within normal range. And so far, I've found that Patty's been stating her pain before getting meds somewhere around a 4 out of 10, and then afterwards, the post-assessment has been about 2 out of 10.
Yeah,
Do you agree with that?
I'd say so. The 2 oxycodone seems to be making me groggy, though. Can we try something different?
Yeah, so I think what we can do with your plan for today is you're due again at around 9:30. I'll try to bring in 1. And we'll have some food with that, and we'll still alternate between the Tylenol and the IV medication. Does that sound okay?
Yep, sounds like a
Okay.
good plan.
All right.
Okay. So the other thing that I did notice is that she takes Synthroid, and the doctor has the Synthroid in for 9 o'clock. And
I usually
do you
take
wanna
that
do that?
before breakfast.
Okay,
So
and
I
have
take
you
it
ordered your
earlier.
breakfast already?
Yes, I have.
Okay, so I'll make sure I get that into you right away.
Okay, thank
Okay,
you.
You're welcome.
So the Foley catheter was out at about 6 o'clock, and we tried to get up around 10 of 7, and she still has not peed yet.
Okay.
So we're working on that. I've asked, to drink lots of water in
Yeah.
between, keep hydrated.
Yeah.
And the first time that she got up, her legs were a little bit wobbly, so I've asked her to call out for assistance and not try to get up on her own that next time.
I won't.
Okay.
Great.
And so, sometimes after the catheter comes out, it takes a little bit before you have that desire to go. So I'll probably be reminding you just in case.
Oh.
Right now, in the next couple of hours, we'll probably want to get you up, at least go in, change your pad, and see if you can try to go pee. So
Okay.
we'll make a plan for that. And we'll be monitoring. So we'll collect in the bathroom, there'll be a little container. We'll monitor what you're drinking, and we'll monitor what you're peeing out.
Okay.
And she's saline locked, right AC here. It's looked really good so far. It has been flushing well, so I think you'll be good
Okay,
with that.
great.
And
Usually it'll stay in until you're done your IV pain medication, and then we'll kind of reevaluate
Okay.
where you're at.
Okay.
so the feeding plan for Eli is breastfeeding, and Patty does have some experience with breastfeeding. Your first daughter,
Mhm.
you breastfed, and what I understand is you had a little bit of trouble with milk supply establishing
Yes.
that initially.
In the beginning.
In the
In the
beginning.
beginning? Okay.
So we've talked about having Pam come in and help out with just making sure that's on a good track for today.
Okay.
Yeah, that
So
would be
I'll
good.
contact Pam. I'll put her number once I find out what it is on the board, and we'll kind of work together with you. Is your plan to exclusively breastfeed?
Yes, it is.
Okay. So then we'll work with you on that. Okay.
Okay.
And so far, Eli's had 1 void and 1 stool, so we'll just keep monitoring those diapers for today.
Okay. Great.
Do you have any questions or anything else you'd like to
Um,
add?
Can Eli have a bath? I have visitors coming in later, and I want to make sure he's looking good.
Yeah.
Okay. So I just have to look at the orders, see how many more sugars he has, and then we'll make a plan with the CNA as to, because we can do the bath right in the room. So let me go over the timing. When do you expect your company?
2 o'clock.
Okay, so it'll be, I think before then. So let me just, what I'll do is I'll look at the computer, find out when everything's due, and I'll come in and put that on your plan
Okay.
for today. But yes, he'll get one. We just have to make sure he's done his blood sugars.
Oh, okay.
Okay.
Are there any other tests that he'll be having today?
I will look, knowing that he's in that first 24 hours, he'll get a hearing test probably around midday.
Okay.
And then we'll be checking you both every 4 hours until you hit that 24-hour mark. If there's anything else that we're going to do, I'll put it on your board.
Okay.
Okay?
All right. I hope you have a great day, and thank you for letting me care for you today.
Oh, well, thank you for all your help.
You're welcome. I'll see you
Patty,
tonight.
I'm just going to put my name up here and the CNA coming in. And then when I come back in, we'll update it with a more specific plan. Dr. Sansonetti's, somebody from the office will be coming in, and somebody from Dr. Tannenbaum's office will come in and check you and the baby today.
Okay, thank you very much.
Okay, if you need me before I come back in, just ring the call bell, but I'm gonna go meet my other patients now.
Okay,
Okay.
thank
I
you.
want to make sure our bed's on real quick. We'll see
Okay.
that. Yep.
Yeah.
Good to go. Okay.
All right, thanks.
Excellent. And you have your call bell?
Yes, I do.
Okay.
Right there.
Okay, perfect. Thank you.